This is the second part of a primary dentition lecture. In this part, I'll present a brief description of each primary tooth. Starting with primary maxillary central incisor, the primary incisors do not exhibit mamelons when they erupt. Their incisal edges are flat and smooth compared with permanent incisors. Primary incisors are wider mesiodistally than they are long cervico-incisally, which is a main feature for all primary teeth. They are wider than their crown length. From lingual aspect, primary incisors or maxillary central incisor have a well-developed marginal ridges, a prominent cingulum, sometimes cingulum extend to middle third of the crown. From proximal aspect, the main features of all primary teeth can be seen, which is constriction or marked constriction of cervical portion, prominent cervical ridge labially. In addition, the crown appears thick in relation to its total length. The incisal edges of maxillary incisors are located labial to long axis of root, which is similar to the permanent incisors regarding this aspect. The primary maxillary lateral incisor is similar to the primary central with some variation. The crown is smaller in all dimensions, whether mesiodistal width, crown length, or labiolingual dimension. The disto-incisal angle of the crown is more rounded than that of primary central incisor. The root is similar in shape to the primary central, but it's much longer in proportion to its crown length. Since the crown is shorter, so the root will appear longer. The primary maxillary canine shows the following features. The cusp is more pointed and sharper than its permanent successor. The mesial slope of the cusp is longer than the distal slope. The mesial and distal outlines are quite convex in the primary canines. From proximal aspect, the marked constriction of cervical portion and the prominent cervical ridge is obvious, and the root is about twice as long as the crown, and it's more slender than its permanent successor. The primary mandibular central incisor shows the following features. The lingual surface appears smooth and tapers toward the prominent cingulum. There is marked convexity or prominence of the labial and lingual contours, which are located in the cervical third, opposing each other. From the mesial aspect, the incisal ridge is centered over the root, and in this feature, it's different from permanent incisors where their incisal edges are located lingual to the long axis of the root. The primary mandibular lateral is similar to the primary central, except it's larger in mesiodistal width and crown length, but the labiolingual dimension is similar. The cingulum and marginal ridges are more developed compared to the primary central, and the incisal edge slopes downward distally at its distal margin, and it's more rounded. The primary mandibular canine. It's similar to permanent canine except for its smaller dimension. However, it differs from the primary maxillary canine in the following. The cervical ridges, labially and lingually, or the cingulum lingually, are not quite prominent as in the primary maxillary canine, and the mesial slope is shorter than distal slope, which is similar to a permanent mandibular canine. Moving to primary molars, General differences between primary molars and permanent molars are: deciduous molars are more bulbous, bell-shaped, with marked cervical constriction. Buccal and lingual surfaces converge sharply occlusally, resulting in a narrow occlusal table. This can be seen mainly in the primary first molars. There are more supplemental grooves from occlusal aspect, and the occlusal surface is more flat. Bifurcation of molar roots is placed more cervically, so the rooted trunk appears much smaller compared with permanent molars. Description of primary maxillary first molar. The primary maxillary first molar shows either 3 or 4 cusps, 2 buccal and 2 lingual. The mesiolingual cusp is the longest and sharpest, while the distal lingual cusp is poorly defined or sometimes even absent, so it will be presented with 3 cusps only. It has 3 roots, just like permanent maxillary molars: mesobuccal, distobuccal, and the lingual root, which is the longest and largest. You can notice from proximal aspect that the roots are slender, long compared to crown size, and they are widely flared and separated at their apices. Regarding the form of this tooth, some authors consider primary maxillary first molar similar to a permanent premolar, especially from mesial aspect. So if we remove this part, it will look quite similar to a maxillary premolar. The maxillary second molar is larger than first molar and has characteristics resembling those of permanent maxillary first molar, but with smaller dimensions. The occlusal surface is rhomboidal. It has 4 well-developed cusps, 2 buccal and 2 lingual, and an additional 5th cusp or tubercle of Carabelli. It has 4 fossae, 3 pits, oblique ridge. The roots are slender and much longer than those of permanent maxillary first molar and widely separated. So if we examine the primary maxillary molars from occlusal aspect, this is the maxillary first and this is maxillary second. Notice there are 4 cusps: the mesobuccal, the distobuccal, the mesiolingual, and the small or poorly defined distolingual cusp. There is central groove, buccal developmental groove, and a distal developmental groove separating the distolingual cusp from the remaining cusps. Moving to maxillary second, 4 cusps can be seen: mesobuccal, distobuccal, mesiolingual, which is the largest, and distolingual in addition to 5th cusp. There is the central groove, the buccal developmental groove, the distal developmental groove, and lingual developmental groove. The oblique ridge is prominent, but it's not quite oblique. It's rather straight compared with permanent maxillary first molar. Moving to mandibular primary molars, the mandibular first molar does not resemble any of our teeth, whether in deciduous or permanent. So it has a unique form, mainly from occlusal aspect. It possesses 4 cusps, 2 buccal and 2 lingual, and 2 roots, mesial and distal. The mesiolingual cusp is the longest. This is the mesiolingual cusp. It's the largest cusp. The occlusal surface is rhomboidal in outline. From a central pit, 3 grooves are seen: buccal, central, and lingual developmental grooves. The mandibular second molar has characteristics resemble those of permanent mandibular first molar, but with smaller dimensions. Occlusal aspect is rectangular. There are 2 roots, smaller root trunk, 5 cusps, free buccal and 2 lingual. The free buccals are similar in size, as well as the 2 lingual are nearly equal in size. So examining the primary mandibular molars from occlusal aspect, this is the mandibular first molar and this is mandibular second molar. You can notice 4 cusps. This is mesiobuccal, distobuccal, distolingual, and the largest mesiolingual cusp. The mesial cusps are larger than distal cusps. There is a central developmental groove, buccal developmental groove separating 2 buccal cusps, and lingual developmental groove separating the 2 lingual cusps. Mandibular second molar shows 5 cusps, free buccal, mesiobuccal, distobuccal, and distal cusp, and 2 lingual, mesiolingual, and distolingual. The free buccal cusps are of nearly equal size. There is central developmental groove extending in the center of the crown. There is mesiobuccal developmental groove, distobuccal developmental groove, and lingual developmental groove.